It's a question that haunts just about every minute of every day for parents, teachers, other school staff, and administrators. What will school look like come fall? For weeks, the president has been pushing for a return to in-person learning.
Being at the school, being on the campus is very, very important. Every district should be actively making preparations to open. Again, the children obviously have a very strong immune system.
The new CDC guidelines released late last week echoed that call as well, noting kids appear to be at lower risk for contracting COVID-19 compared to adults. But A, kids are getting sick, as evidenced by the 5 who've recently died in Florida, where more than 300 young people have been hospitalized. And B, as we all know, it won't just be kids who have to go back to schools, as at least one government official managed to remember.
When you talk about forcing teachers to come back to school, you better be careful about that and make sure you pay attention to, A, keeping them safe and keeping them healthy.
To that end, the second largest teachers union in the country, the American Federation of Teachers, said today it would support members if they opted to strike in districts that are looking to reopen schools without sufficient health and safety protocols. In fact, the AFT argues coronavirus transmission rates should be under 1% to safely reopen, which, for the record, is a threshold we were below in Massachusetts since late March, but which we rose back above more than a week ago. And as the Boston Globe highlighted today, doctors are increasingly concerned about the uptick in coronavirus cases they're seeing around the state. Still, many districts are moving forward with plans that will likely involve at least partial in-person classes in September. And the state just agreed to give schools the option to delay start dates until as late as September 16th. That's 2 weeks later than the initial requirement, to allow more time for planning for the difficult year ahead. And the fact is, it will be difficult no matter which road schools take. But the delayed start was just one thing teachers' unions have been seeking. And tomorrow, nurses with the Boston Teachers Union are planning a sit-in at City Hall Plaza. I'm joined now by Jessica Tang. Jessica is the president of the Boston Teachers Union. She used to teach middle school in the city. Merrie Najimy is president of the Mass Teachers Association. She used to teach elementary school in Concord. Merrie and Jessica, thanks so much for being here.
Thank you for having this conversation. It's such a critical one.
Thank you. Jessica, let me start with you on a current event. As I mentioned, your parent union said they'd support local unions if they decided to strike in jurisdictions where the metrics were not below a certain level. And as you know, the transmission rate is not below that level in Massachusetts. What might that mean for Boston?
Well, in Massachusetts, it's not a conversation that we can take lightly, unlike other states like California or Chicago, where it is legal for public sector workers to strike. That's not the situation here. However, I think the point that needs to be made is that we will do whatever it takes to ensure that our schools are opened safely with proper protocols in place and in a situation where it is thoughtful and equitable, and we do not have to ask educators or students or families to take a gamble.
Well, you know, on that line, Merrie, I know that both of you were involved in successful negotiations with the state that led to this 10-day delay that allows, I think these were your words, allow a redesign of school in the age of COVID-19. What else stands between today and reopening in a healthy fashion come the fall?
Yeah, Jim, you alluded to it in your introduction. There is a fundamental lack of honesty about what it takes. The commissioner, the governor, the president simply think it's a simple retooling of the systems as they are. Anyone who's been in education as long as Jessica and I have been know it's a fundamental change to the system. We need, first of all, buildings, every single building to be inspected and updated to meet environmental health and safety standards. Community and public health benchmarks, rapid testing and tracing, and then we really need time to redesign our curriculum. COVID is with us for the long run. School is naturally going to be different.
Were you suggesting, when you use the term dishonestly, were you including the governor and the education commissioner in that category?
Yeah, when you look at the science that the commissioner is selecting, it matches the state's unwillingness to conform a budget to what it really needs. And the science is changing on a daily basis, and all of the indicators are pointing to how unsafe it is to go back to the buildings.
Jessica, is there anything you'd add to the list that Merrie is giving about what are the critical steps that need to be taken before a healthy return is agreed to?
You know, the frustrating part is that we are all aligned, the teachers across the state, of what's needed. We all agree that we need time for planning, for professional development. We need a slow, phased-in response, and health and safety has to be addressed before we can even talk about anybody going back in person, especially when we have so many school buildings like in Boston that were built before World War I, World War II. Only 30 schools have HVAC systems. Plenty of classrooms don't even have windows or windows that open if they do have windows. And when we had to fight for just soap, warm water, and paper towels for bathrooms over the last few years, there's a lot of work that needs to be going into assuring that we're not going to have to fight for all the necessary safety and health protocols, too.
Jessica, I want to follow, though. Are you suggesting that the people in charge, whether it's the governor or Commissioner Riley, don't care about the health and safety of the kids and the people who work in the schools, or they're just not adequately addressing those issues? Which is it? Jessica.
Well, I like to always hope that everyone cares about the students as much as we do, too. But I think it's also a matter of where the funding is. So we can have the best intentions of wanting to reopen schools and wanting to bring back as many students as possible. But if we are given the same insufficient budgets that we've had for far too long now, while we're being asked to do more, then it's just unrealistic. So we need the federal government to pass the HEROES Act. We need the states to also ensure that they fully fund the Student Opportunities Act as well.
You know, Merrie, I want to spend our time not so much on the students, because we all know that the dynamic change with that South Korea study suggesting that 10 to 19-year-olds are as likely to transmit as adults are. I want to talk about teachers. When Commissioner Riley was on our radio show with me and Marjorie Egan a couple of weeks ago, we said to them, what happens if schools reopen and a teacher in good faith believes that he or she is not safe going back into school? What does he or she do? And Commissioner Riley said he was speaking to the unions, speaking to the teachers around the state to try to reach some closure on that issue. What does a teacher do? Schools open, even if your criteria are satisfied, and a teacher in good faith either feels that she's not safe or he feels that with a parent living at home with them who's 75 years old, it's not safe to go into school. What option, what choice, if any, will that teacher have?
So, Jim, this is one of the fundamental problems and questions. It's a solution that is not easily arrived at, and that's why we have to look bigger than just the individual teacher. The safest way, no matter what, educators want to be back with their students. It's the only way and the best way to learn. But if we all start from home, winning this 10 days of phased reopening actually gives us time to think about and answer questions such as that. And it also, if we are all at home and wait out the pandemic, we will see over time how indicators are changing for the worse or the better. Because what I want to reinforce here, too, this is not about the individual. This is about what happens when an individual is at risk and then brings the COVID out to their community. Everybody becomes at risk.
Jessica, do you agree with what Merrie's saying here?
Yeah, I do, because I think also we have to understand that this is a novel coronavirus, right? And there's so much that we don't know. So is there a situation where we can 100% guarantee that someone is not going to be exposed or get sick?
There'll never be a situation where it's 100% anything, obviously.
Right. And so, and again, this is one of those things where it's a life or death matter. And, it's easy to say, oh, well, it's only 1% of, the students who might get sick and only a small percent who might die. But if that is your son or daughter or your loved one or your family member, that's not an acceptable risk to take.
But, Jessica, that sounds to me like you're saying, excuse me, Jessica, that sounds to me like you're saying until there's a vaccine, then we shouldn't have kids back in school buildings. Is that what you're saying?
Well, I'm not saying that, well, certainly for all in person, yes. I think that would be based on everything. Again, we have to look at the science and the research.
How about partial
and
in person?
Yeah. But, if there are situations where teachers are willing to go in, but again, it has to be a choice, both for the parents and I think for educators of, if they have a loved one or they themselves have underlying health issues, that
Sure.
that risk is not worth taking. And there has to be assurances too that.
I only have a minute left. Can I get quick comments from both of you? Everybody agrees, obviously, that in-classroom education is better education than remote education. I mean, that's a given. It doesn't matter who you are. What is also a given, it seems to me, that the long-term cost for kids, especially kids of color and poor kids, of remote learning is immense and potentially unfixable. So quickly, Merrie, if I can, how does that factor into your strategy when dealing with the state over what are the criteria for reopening?
Right. That is weighing heavy on the minds of all educators, because what's really at the root here is the legacy of structural racism, of disinvestment in public education for years. However, we also have to recognize that when we bring kids into the buildings, they can't get out of their chairs or have recess or interact or see their teachers in full gear or have to be witness to someone who catches the virus or dies from the virus. That is as emotionally traumatizing as staying home. And therefore, it's beholden on the state to fully fund public education and get internet access to every single child and adult in Massachusetts.
Jessica, can you take 30 seconds and answer the same question, please?
Sure. Again, it's a matter of will. If we really want to reopen our schools and bring back our students, then we need the supports and the funding, the resources, and the time to do so. It's one thing just to say, okay, everyone should go back because it'll help the economy. And it's another to say, okay, we want everyone to go back because we care about our students and our educators and making sure that they have the best education possible during this unprecedented pandemic. And you can't say one without actually the resources we needed to actually get it done successfully.
Jessica Tang, Merrie Najimy, thank you so much and good luck in the weeks ahead. We appreciate it.